Hello everybody and welcome back to the Fibroid Doc, where you can find all the information you need to live a life free of fibroids. And in today's episode, I would like to discuss the top 5 ways you can tell you may have fibroids. Okay, and I would like to do so by telling you a patient story. So I saw this patient earlier this year. She was 54, so nearing menopause, and she was just having a few periods a year, but very, very heavy and just irregular and, extremely heavy. And the reason she came to my office, though, primarily was because of pain. So she had excruciating pain. I mean, I see a lot of patients with fibroids and pelvic pain, but I was really taken aback by this patient's presentation. She had back pain, pain in her pelvis, pain in her abdomen. She could barely walk. She was taking Motrin, Tylenol. She even had a lidocaine patch on when I saw her. Just a lot of pelvic pain. She also complained of having to pee a lot. She said she didn't drink a lot of coffee. Actually, she didn't drink any coffee over the last year. She wasn't drinking a lot of water all the time. She wasn't one of those people carrying a large water bottle, chugging down water, but still she had to go to the bathroom every hour. She also said that, despite having the same diet in the last year and not really gaining, any extra weight, her pants wouldn't just button like they used to. She could barely, close her pants. And so this was sort of a new symptom also that she had. And then lastly, she also complained of painful sex. She said she had so much pain, just wasn't possible anymore. And so, she had all these symptoms. Again, the pain was the primary symptom she presented with, but she had all of these symptoms. And then I went on to examine her, and sure enough, she had a large mass that filled her pelvis, from the bottom of her pelvis, from her cervix all the way to the top of her belly button, above her belly button, and it expanded on all directions, up, down, right, left. I mean, it was this huge, rock solid mass. This patient presented with the top 5 symptoms that patients with fibroids have. So number 1, pelvic pain. Number 2, heavy and abnormal bleeding. Number 3, bloating. Number 4, frequent urination. And number 5, painful sex. And these are in no specific order, and you don't have to have all 5 to have fibroids. But if you have 1 or even 2 of these, you should start thinking about the possibility that you may have fibroids, and you should definitely see your physician. I hope you found this useful. If you did, or you know somebody who may find this useful, please share this channel with them and subscribe. And I'll see you next time. Bye.